Well, I'm delighted to say we're having another chat with David Ashford, Minister for Health and Social Care. But David, your hat will be also Cohen, because the questions I've put out a thing asking people to get in touch with us, and they're wide and varied. You haven't seen them. I'm sure some are ones that you've done before. In fact, we were just joking. But I don't want to say that, and I don't want to say baby steps. Can you try?
I'll try my best, Paul. I'm not promising anything.
No,
but I'll give it a go.
Okay. Well, as I said, we've got all sorts here. So first of all, hi David, I wonder if you can clear a few things up for me. Is it a legal requirement to wear PPE to work as hairdressers? I have a home salon where my 2-year-old comes to work with me. Clearly she can't keep a mask on. I don't wear one due to asthma, making it difficult to breathe. I'm basically making sure if I have one client at a time, keep records, who's been in, no one is in there who shouldn't be, and obviously cleaning and disinfecting, and all that will be adhered to. Would I be allowed to work? 23rd of March was my last working day. I have no money personally from government as I've had a grant for my business. I'm not eligible to claim until the 1st of June, which accidentally, of course, is the day we're allowed to return to work. It's a bit longer than that, but I think that's most of that. Can you help?
Yeah, in relation to hairdressers, Paul, obviously we would recommend the use of PPE in terms of the guidance, in terms of using gloves, face mask, and also, where appropriate, separating out clients if there's multiple clients, but from the sounds of that, it's one client at a time. To my knowledge, that hasn't been transcribed in law. It certainly haven't seen any regulations yet, but obviously there's time yet for the 1st of June. But certainly at the moment, it's not stipulated in law, but it is firm guidance that people returning in those circumstances should use appropriate PPE. And
she hasn't been paid any money for that length of time. Is that how it should be, or is that just a mistake, or what?
Well, I don't know. Without knowing what schemes the lady's actually applied for, I can't really answer that. But obviously there are the government schemes there. I know from some of the schemes initially, they were people who were self-employed were excluded from some of those schemes. The Treasury Minister made announcements in the last week or so that some of those schemes are now opening up to the self-employed. But obviously in the sector this lady's in, it's potentially going back to work on the 1st of June if cases remain as they are.
Could you possibly ask David when the shielded will be released? A friend has called her consultant and has been told, was told down to government on this, and vice versa. Many people feel forgotten.
I can assure the people who have been shielding they haven't been forgotten about. New advice for the shielded has been being worked up over the last couple of weeks. It is important we get that advice right. Because obviously it's based around what's happening within the community at any one time. We wrote out originally to everyone shielding with advice as to what they should and shouldn't be doing, and we will be writing out again over the next week. I believe the letters will be going out with updated advice with the current situation on Ireland.
And if they've never heard anything in the first place, they are forgotten. I mean, they're not on the list. I mean, that can happen.
Well, if they're not, Paul, if they've not heard anything in the first place, then they're not someone who needs to shield.
You hope.
The people who need to shield. We've got to get a difference here between shielding and self-isolation. So there might be people who themselves feel they're vulnerable in the older category that actually feel that they should be self-isolating, and that's their personal choice. But then there's the people who should be shielding, and the people who are shielding are the people who have serious underlying medical health conditions that have been written to by the Department of Health and Social Care to actually tell them that because of their condition they're at high risk should they contract COVID. So it is important we get that distinction between the group, the elderly group who might have made the choice to self-isolate because they've heard about the issues with COVID-19, and the older age groups, and those that have actually been directed to shield. They're two different things.
Fine. This is interesting. I'm not sure if this is David Ashford's bag, but he seems to be well clued up on most topics. All right.
Yeah, sounds like a challenge now, Paul.
Well, I'm concerned about the number of people sent to prison with COVID-19 offences, 80 plus in brackets. I don't know if that's you might know. Anyway, only 4 for fixed penalty notices have been issued. Again, this is going on these numbers. So the cost of detaining a prisoner is about £150 a day. Due to the virus, that cost could easily be up to £200 a day. That's £14,000 a week. 2-week sentence equals £2,800. Now, some have had 6-week sentences. The total cost of imprisonment could be approximately £250,000. If they'd had fixed penalty notices, the government could have seen revenue of up to £20,000 instead of costing us £250,000. Your point?
Right, I need to clarify that 84 figure. I think that's come off a answer that was given in Tynwald last week by the Minister for Home Affairs. The 84 is actually the number of arrests for COVID breaches. It's not the number who have gone to prison. The number who have gone to prison is 12 on the figures I've seen.
Yeah, I thought it was too high, that 80. It must have been,
yeah. So the 84 is people who've basically been arrested. I believe there's been 24 on remand at one point or another, so they obviously have been on remand. But in terms of actual prison sentences handed down, the latest statistics I have is it's 12. Obviously, that isn't just for any old breaches. There will be serious breaches if they've actually incurred a prison sentence, and several of them have been in the news. It is important people obey the rules that are in place around COVID-19, and I think it sends a message out what happens in relation to people if they don't, because they are endangering not just themselves but potentially the community.
Right, this next question, and you have done this a few times with me, but it's always important because not everyone's watching all the interviews and there's updates, right? So bear with me. Could you ask why have the capacity to test 200 people a day? Why are we only testing 50? Why do they fail to test all the people identified by contact tracing that are being put at risk? And why do they fail to test key workers repeatedly? How many times have you been tested for the virus? Okay, I'm asking you.
I haven't been tested for the virus because I've not come up in any of the contact tracing. In fact, the nearest person I've been to with who contracted the virus was obviously probably our Ireland's most famous case, the Chief Minister. But at that time, even with the press conferences, what a lot of people don't realise is we're never together at the same time. I know it looks a bit odd sometimes with us shifting in and out, but I'm actually out in a corridor away from the Chief Minister and he's out away from me when we're doing our pieces, so social distancing was in play. So I was never identified as a direct contact when the Chief Minister was identified, and I've never shown any symptoms. In relation to testing, yes, I have before, and I will resist using the phrase, Paul, that we use at the press conferences sometimes about we haven't answered it before. Yeah. But in terms of testing, sometimes there's a confusion about the purpose of the test. The purpose of the test is not to tell someone they have got COVID-19. The purpose of the test is to actually identify if that person has and then isolate their contacts. So you wouldn't test, for instance, if you had someone in a household who developed COVID-19, you wouldn't then test the rest of the household because the entire household has to self-isolate from that point for the high-end incubation period of the virus, which is 14 days.
But now we've got this extra capacity, David. Surely now you could test. I mean, it'd be useful to know, wouldn't it, if they had it or not?
To move on to that and the extra capacity.
Right.
Because we did have extra capacity created when we went with the On-Ireland Test Centre, which can do up to 200 a day. We actually have changed our testing policy because calls through 111 are now dropping off. So what we have done is we are going out to frontline key workers and saying if they wish to be tested, they can actually be tested weekly. So those who actually work in nursing homes, those who actually work frontline in the hospital. We've offered it to the police as well, who are out in the community. And we are actually going around and proactively doing residents in nursing homes as well. So I know already I've spoken to several people who've already had that done and taken up that offer, and that will take up the expansion of testing that we have, because it is important to emphasise again that with PCR testing, which is what it is, the swab test, it is a point-in-time test. So it only tells you that you haven't got it at that point. And we do know in the very, very early days of the incubation of this virus as well, so the first couple of days, if you take a PCR test then, it may well come back negative, but you still do have COVID-19. So there is false negatives.
So the people in a house, someone's got it, and they wait their 14 days, they could actually bring 111 and get a test, I suppose, but that just seems a bit of a workaround.
No, they wouldn't be. If they were already, if someone's been tested in that household and has tested positive, and is then the household's then locked down for 14 days. If someone else then displays symptoms, the household would then have to self-isolate for another 14 days from the last display of symptoms.
Right.
Because that is the high end period of it's 14 days resets effectively. But the purpose of the test is to break the chain of the virus, and that's why we've stuck with community testing, whereas the UK went to only testing people in hospital. We stuck with community testing because what you do is you catch the people that are close to that person, you isolate them, and if they do then go on to develop symptoms, they've not been in contact with anyone else to pass it on.
Fine, and this one will come up time and time again, but anyway, we've got loads to go through. The World Health Organization identifies the over 60s as a significantly increased risk of mortality, yet only the over 70s are shielded. Is this fair on the 60s age group and their families?
Well, there's mixed debate around this. In fact, actually, the science is suggesting there's a lot of other age groups as well that are at risk from COVID-19. It doesn't discriminate, although there seems to be more prevalence amongst the older age groups. If you now look at the statistics, they're starting to even out a bit more in terms of age groups. In terms of the over 60s, it's an increased risk, but the World Health Organization also says the serious risk is those for 70 and above. So although there is an increased risk for the 60 to 70 category, the serious risk category, as categorised by WHO as well, is the over 70s. And so the over 70s are written to and shielded, but equally, it's not just the over 70s that are shielded, because the department also writes to those with serious underlying health conditions, regardless of age, and tells them that they should be shielding.
Cyclists on the roads are not keeping 2 metres apart from pedestrians and cannot safely do so without a road traffic accident or the risk of it. Sudden close contact with cyclists is unavoidable for pedestrians. Have you considered banning cyclists on the road or enforcing cyclists and pedestrians to wear masks?
It's not just with cyclists, it's not just around the 2 metre rule. Obviously, there's a period of time as well. If a cyclist is stopping having a chat with someone within 2 metres, then obviously there is an issue there. But you should be in contact with a cyclist going past less than 2 metres for only seconds. And one of the things we know about this virus is it's a combination of factors. So being less than 2 metres apart and also being in someone's presence for 15 minutes or more is what radically increases the risk profile. So unless you've got someone like me on a bike where it probably would take 15 minutes to cycle past someone, then basically, the risk profile is quite low, even if they are within 2 metres of going past a pedestrian.
Can we consider safe air bridges for business and leisure, like Jersey and Guernsey, for example, and maybe Iceland for leisure holidays? There are others. Free movement when they arrive, no quarantine perhaps, from July onwards, with a small number of departures.
That is something that is being discussed. I know it's a big topic around the world at the moment, air bridges. But one of the things that obviously will factor into air bridges is what that country you're having the air bridge to is doing. While they may have a low number of cases, if they are allowing in flights from countries that have got a high number of cases, there's still the risk of mixing either in the airport or anywhere else. So I know air bridges is the big thing at the moment, and it's really hit the headlines, particularly in the UK. But I think there's things there that still need to be worked out. I know I'm naturally cautious, and like I think we've said before, I sometimes come across as a merchant of doom. But I think we really need to look at. We need to make sure that any air bridge country we're going to, the controls they have in place for people coming in and out actually work, because let's not forget air bridges can actually work both ways. So for instance, if we're allowing, say we had an air bridge, highly impractical at the moment, but say we had an air bridge with Spain, there's nothing to stop people coming from Spain into the Isle of Man. So we've got, and what's to stop someone travelling from Italy into Spain and then into the Isle of Man? So it's those sort of things that then have to be worked through with an air bridge.
I haven't been down the airport, but I presume there's been a fair bit of work putting in spacing marks and ways of how we are going to travel. Do you think it will be absolutely mandatory to have a mask on, for instance, and that sort of thing when we do start travelling here?
Obviously with aeroplanes, because you're very, very compacted in, I know certainly, that will be for the airport itself to decide on in terms of safety, but certainly I know Heathrow, Gatwick and other airports have been looking at that. they've been looking at the 2 metres, but of course they've come up against problems there, because I think it was the chief executive of Heathrow. I've got it it's either Heathrow or Gatwick, and I'm probably sod's law I've picked the wrong one, but I think it was the chief executive of Heathrow that actually turned round and pointed out that if they do the 2 metre rule, just to get one international queue through would be about a mile long queue. So there's practicalities there, and I think it's going to be very difficult for the airline industry in those circumstances to try and operate.
They're testing the heat guns. I know you're not a big fan of that because you're saying, of course, it doesn't even mean that much. But I mean, if Heathrow's doing a heat gun, maybe we will all be doing that again.
We're using it for returning residents at the moment, Paul, at the ports. But again, it's one of those things I have to emphasise that the value of it is very debatable, because it will only show if someone has a temperature. So anyone who's got a temperature shouldn't really be travelling anyway, or attempting to travel. But as we know with COVID-19, everyone's unique. Some people don't display the temperature but still have it, and some people in the early incubation, and certainly in the incubation period, don't display temperature.
Last week, the government announced that self-catering establishments could open to visitors from this Monday. On Friday, DfE issued a guide to hosts covering the cleanliness regimes and adopting what they need to do, and so on, but with very little notice. Why has government not followed the recommendations of the body, which is the CDC, Centre for Disease Control, for leaving a property 24 hours before cleaning or 72 hours between bookings, even if guests develop symptoms of the disease during their stay? It's a very long question, but there's more. But does that make sense, or anything there you can talk to?
So the Centre for Disease Control, I assume, I mean, it depends which Centre for Disease Control they're talking about, because the Americans call theirs Centre for Disease Control, and so do the EU. So I assume it's the EU guidance that the person is referring to. Obviously, we look at it, we take it on a risk-based process. It's probably more a question for DfE than it is for me, because they're the ones who will have helped draw up the guidance and get it out. But I would assume it's because we've got a low risk profile on the island in terms of the self-catered accommodation. As long as you have proper deep cleaning in place, there would be no necessarily logical reason to actually leave it 24 hours if appropriate cleaning has been done, because you would have killed the virus on any surfaces. And we also know that in terms of surfaces, the length of time the virus can survive is minimal.
And part two of this, can you explain how camping and glamping sites, some which don't have hot or cold running water, and shared kitchens and bathrooms have been permitted to open before self-contained properties, and how can that possibly be safe, and what inspections are taking place to ensure the protocols are being adhered to?
Well, actually, there is inspections. There's the DEFA, Health and Safety at Work team actually cover that, and they will be going out and doing inspections. Also, there is a requirement for campsites, etc., to be able to provide hot running water and for people to be able to clean and to wash hands. But the other crucial requirement is that people must stay within their own household when camping. So there must be the social distance. They must remain within their own household. It's not a case of a free-for-all where households mix. That is actually illegal.
I did say we'd be switching around a bit. This one was with your Coleman hat on. The plane owned by Flybe was taken away from the Isle of Man. It was seen, and people took pictures of it. Who gave it permission to leave? Does Flybe still owe the Manx government money? And if so, has the plane been given permission to leave? Or was it not going to be impounded till the debts were paid?
I would assume if the plane's been released, then the debt is being paid, Paul. But I don't have any further information on that. That's a matter for Treasury.
Okay. This person said they read the World Health Organization guidelines earlier in the week, stay a minimum of 1 metre away from others. But when asked the other day, you said in one of the press conferences you prefer 2 metres. So using the WHO guidance, we could now all be back to the offices and schools instead of stuck at home whilst money and time are wasted reconfiguring space.
Right, we need to be very clear on this, and exactly what I did say at the press conference. The WHO guidance is a minimum of 1 metre. And 1 metre at least. It is not saying people should be 1 metre apart. It is saying at least 1 metre. The actual Director General of WHO, and if you go back and listen to the WHO press conferences, they say the ideal situation is 2 metres, because in scientific studies, that's how far, in terms of someone coughing or sneezing, the average of the travel of the spray. We are sticking with the 2 metres because we think that is sensible. Different countries from around the world have made different judgments. Some have gone for 1 metre, some have gone even for 1.5 metres, whereas we have stuck firmly with the 2, same as New Zealand and several other countries. We believe the 2 metres at the moment is sensible. Everything is constantly under review, and I know people are probably sick of hearing me say that as well. So at a future point, we may review the 2 metres to go to 1, but we're not there yet.
I'm a very small sole trader in a massage therapy business. I feel like a mushroom. I have no idea where I stand in relation to the opening of my business. I've been finding out from other people in other businesses, and my situation is different from them. No one from health department has been in touch. Nothing useful has been even put through the business door to suggest what needs to be done. If I'm to reopen, I need to make investment in PPE, but I can't even find out what I will need. Please, can you ask?
Well, in terms of PPE, as far as I'm aware, the guidance is now available in terms of the beauty and lifestyle industry. I would, in that kind of circumstances, obviously it would be appropriate gloves, coverings, and mask, both for themselves and for their client. In terms of the contact with businesses, with the best will in the world, Alaman government cannot contact every single business in every single sector to give them personalised advice. When we look to reopen sectors, it's for the business themselves to ensure that they're operating correctly. All government is doing is we are facilitating people to open, and I need to make that absolutely clear. We are not forcing people to open. People need to do so when they are ready to do so. All government is doing is removing certain businesses from the list of businesses that by law must be closed.
This next one you touched on with in your public press conference, I think, but it's worth going over it, I think. How can taxis work, yet we can't take non-family people in our own cars? I mean, that is quite interesting, because, I mean, you know, a taxi over here hasn't got any shielding, has it?
No, well, taxis have very strict cleaning regimes applied to them in terms of the cab has to be cleaned after every single passenger. As part of the public health rules applicable to taxis. So in terms of handles, surfaces, everything else, private cars, there is absolutely no way of enforcing that. So at the moment, the risk profile of household sharing is actually a problem. And also with taxis at the moment, no one should be in the front of the taxi other than the driver. So no one should be next to the driver in relation to a taxi. Household car sharing, we could not enforce that because you wouldn't know, even if the police stopped someone, who was in someone's household or who wasn't. So it's completely unenforceable. It's something, again, that is consistently looked at as to when we want to be able to turn back on household car sharing. But again, at the moment, we are not quite at that stage.
Okay, this next one, I've had quite a few calls, although no one would do an interview about it. It's about the TT and not getting a refund from hotels. And we're talking about different hotels, and some of them are quite big ones, and I don't want to name them, but I'm sure you've also been hearing this. They're not getting any joy whatsoever. I mean, I presume they want a refund because they can't come next year. I'm sure they're trying to move people on to 2021. But what do you think about that, to, you know, with people who want a refund on their accommodation?
I mean, obviously, hotels are private businesses, and there'll be different terms and conditions applicable to people's bookings. I mean, I would urge people to check their terms and conditions they're booking. If they've gone through and paid via credit card companies, there's potentially options there in terms of being able to get a refund. If they've actually booked via a travel agent, I would urge them to get in touch with their travel agent to see exactly what the terms and conditions are. I know some hotels have done refunds in full. Other hotels have gone down the route of actually, as you just said, Paul, rebooking people for next year, or even, I've heard in a couple of cases, a few years down the line. And other hotels have taken a very strict policy that it doesn't fall under their terms and conditions, so they're not going to refund. As a private business, that is a matter for them. It's not something for government to get involved with. But I would urge people to look at their different options, contact the travel agent if they book through a travel agent, contact their credit card company if it's being paid by credit card, and also refer to the terms and conditions of the booking.
The number of public sector workers, this comes up a lot of times, the number of public sector workers who have not worked for the last 6 to 8 weeks, do you have a number on the people who have not, who have been put to one side on this scheme? Are there
Well,
any?
almost all public sector workers have been working. It would be an absolutely minimal number, because even in health and social care, what you might term the administrative staff. So, for instance, if you look at my office, the administrative office that's behind that, all those people have still been working. They've all been working remotely from home, and in fact, if anything, their workloads have gone up, not down. So there will be very minimal numbers, because people who can't do their own job in the public sector have been redeployed to other jobs that they can do. And that's been going on. I think Minister Thomas gave an answer to this although certainly one of my colleagues did, in Tynwald.
Okay, I'm sure that one will keep coming up though. Summer holidays review, please. Let the kids catch up. I know it's a different minister, but this is fast approaching, and Guernsey are fully back on the 8th of June.
Yeah, and obviously Minister Allison's been making announcements around our schools. He's doing the press conference, in fact, later today, where I'm sure he'll have more to say as well. But in terms of schools and the summer holidays, obviously everything is kept constantly under review. I don't know what education is planning in terms of that, but I think what's important is it is going to be a gradual return still. So it's not going to be a big bang and suddenly the schools are back. And I think trying to run schools over the summer holiday period could actually create more problems. I think realistically it is going to be September and the return to schools then, before things are back to what we would term previously as normal.
The next one's more of an observation. It says traffic wardens under instructions from Isle of Man Police, and by the way, Gary Roberts got on to me and says it's not from him. It's to prevent cars only stopping on the quayside to pick up collections from various cafes and restaurants. Feels like running a hospitality business is illegal at the moment. I mean, that's just one of those things that should be common sense, right? That let people pick up items.
It would depend how people are picking them up, to be perfectly honest, Paul. If people are abandoning cars left, right and centre, and blocking traffic, because particularly down on the quay there is limited parking, that has to be recognised. That's an area I represented as a Douglas councillor, so I know quite well the problems that are down there. Then obviously the traffic wardens will be taking enforcement action, and I think common sense does apply. Certainly a few cases I've heard of, there has been common sense applied, that as long as the person isn't just abandoning their car and going for a substantial period of time, then action hasn't been taken. But again, without examples of actual cases, it's very hard to be able to give a full answer on that.
Okay. Since the first week of March, I've been completely deaf in one ear, being told by my GP nurse that syringing is not allowed, which I understand is due to the aerosol situation also connected to dentistry. When can this be sorted? From my understanding, all this is needed is for both ears to be syringed and so on. I'm wearing PPE, goggles, masks, gloves and gowns. We have had only one case confirmed in the last 7 days. Surely we should be moving forward quicker on health issues. People's quality of life has to be considered.
Now, I know this is frustrating for people, because we did have to turn off a lot of services. But one of the reasons as well is, don't forget, we've actually redeployed staff to other areas to deal with COVID-19. Now, if we're going to turn services back on, we first of all have to redeploy those staff back, which means we don't have as many staff to deal with COVID-19 if there is, say, a second spike in cases or cases increase. We need to turn the services on in a logical way, because lots of different services are dependent on other services. So what I announced on Friday is we will be doing 2-week rolling blocks within the Department of Health. I announced on Friday the first services we were bringing back online, such as limited endoscopy, things like that. Also, I announced services around certain levels of optical services being able to open and operate. And we will be doing it in 2-week blocks. I know it's frustrating for people, particularly if they are waiting for something, and elective surgery is a big one, where obviously you can expect my mailbox is quite high, but we've got to do it in a measured manner. The district nursing service will be slowly expanding what they're doing as well, but I mean, the district nursing service has been one of those services that has been under the pump during COVID-19. They've done an absolutely exceptional job to be able to try and keep up with things.
I'm a 75-year-old and live with my 7-year-old granddaughter. What precautions are being taken when the children go back to school? When will we know how it will work. Will this be something we'll hear from Dr. Alex Allison later?
So it is something Dr. Allinson will be expanding upon
Okay.
as we move forward over the next couple of weeks. One of the things that I think I need to emphasise is in relation to children. The evidence from around the world is shifting now. People will probably remember the great tabloid headlines at the start of all this of children as super spreaders of the disease. There is evidence now emerging that children aren't super spreaders, that they actually, for some reason, which this scientific evidence still doesn't seem to know why, they seem to spread the virus less than adults. What is also interesting from the evidence around the world is a lot of countries, or certainly a handful of countries, I should say, a handful of countries did not shut their schools during the outbreaks. But if you look at those countries, there's been no school identified in any of those countries as being the hub for the spread of the virus, which I think is quite interesting. So there's not the evidence around the world that even where schools have been operating, continuing to operate, that it has caused mass spread of the virus. But obviously it is concerning times, but children certainly at the moment do not appear to be the super spreaders that people thought they were at the start of this outbreak.
Oh, we're going to get some great news from Dr. Alex Allison, big stuff today. Is that what's expected?
So Alex will be giving an update as to where the Department of Education is. I never like to big things up or dumb things down, Paul. You'll have to wait and see what Alex has got to say.
Okay. Can you find out when a friend can come into my flat and colour my hair and cut my toenails, as I'm a diabetic and I'm not allowed to cut my own toenails? Right. A lot of old people are in the same position.
Well, in terms of a friend coming in, at the moment the regulations allow for someone to come into your property indoors, up to 2 people, as long as they are from the same household. The suggested guidance is people should stay 2 metres apart and shouldn't be there for more than 15 minutes. But as we've said, that is only guidance. What people do in their own homes is their own business. We can only advise. We can't dictate what people do in their own homes. That's a risk-based that's a risk that people have to decide upon themselves what they believe is appropriate risk for them. So there is nothing actually in law to actually prevent a friend coming round, colouring someone's hair and cutting their toenails now. We would obviously, from a health point of view, advise against it. But if the person wished to do that, they're not breaking any particular law.
Right. Who is on the advisory committee? What is the makeup? Who are these people and their respective groups?
So advisory committee, I assume, is referring to the clinical leadership group. So running it off the top of my head here, and I really am doing it off the top of my head, there's, if I remember rightly, there's 4 GP representatives. There's the clinical psychologist, there's the director of public health, there's the medical director, there is all the clinical directors, there is the microbiological consultant, and I'm sure I've probably missed about 4 or 5 people there.
But how does it work? Do they come to Komen as a group, or do they just make a proposal?
No, they don't. They write a paper for Komen. So any advice comes to Komen via the papers.
Okay, we're almost there, and thanks. I'm sorry to get to everyone here, but I know we've gone quite a long time here. Back in 2007, the then Director of Public Health, they had this sort of tabletop exercise about pandemic flu planning. And basically, this person's wondering if these plans were ever followed during this particular crisis.
They actually were. The government pandemic flu plan, if people really have got nothing to do this afternoon, they can actually Google it and they will find the document that was there. If people look at what was in that document, there's lots of things we have used in this. So, for instance, the command structure, if people go through and look at the gold, bronze, silver command structure, that is all there and implemented and operational. And the way that we are actually responding. Obviously, a document's great, but you've got to also respond to what's actually happening on the ground, not just blindly following a document written quite a few years ago. But yes, the pandemic flu plan and elements of it have been used and been very helpful to use during this outbreak.
Okay, well, if people have more questions, we can maybe do another one with you, David, the weekend. By the way, as you know, it was maybe Sunday.
Always happy to, Paul. You know that.
Most maybe on Sunday, and I can actually thank David for my IT assistance because we couldn't get the machinery to work, and you got the solution, which I thought was just very good of you. And you're
multi-skilled, Paul.
Multi-skilled. So overall, before I let you go, are you feeling more optimistic?
Cautiously optimistic, to use my usual phrase. Obviously, again, you know me very well. I don't do unbridled optimism. I think, obviously it's going in the right direction, but again, we shouldn't be complacent. One of the things I always liked as a school kid, and I still do now, is history. And I remember well the Spanish flu pandemic, which started in 1919, and the first wave came and went. Everyone thought everything was fine, and then the second wave actually hit and was more deadly than the first. In fact, people forget with the Spanish flu, because we keep talking, I've seen worldwide, they talk about the second wave of Spanish flu. There was actually 4 waves in total of Spanish flu.
And potentially we could have a second wave, because now we've got the lockdown released and people are now doing more interaction. This 14-day period like you had when you let the construction workers go back, this sort of wait and see.
It's 8 days normally. You'll start seeing it filtering through in the data, and that is why government has taken this approach. And I know for some people it's frustrating, but we take a decision, we wait. That's why, for instance, the lifestyle treatments we've announced coming back on June the 1st rather than immediately, because it's given us time to see the data from opening non-essential retail, etc. But it is important we take it step by step. And like I say, I'm always very keen to learn the lessons of history as well. Right. And I think history sends us a very powerful message as to what happened in 1919. Okay,
well, we're recording this on Bank Holiday Monday. It's just before midday. You've had your Coman today, have you, already? So things sorted?
There's been no Coman today.
Right.
The Chief Minister has been very generous to us all. There will be National Strategy Group meeting as normal tomorrow, but he's been very generous to all of his ministers and given us a morning away from Council of Ministers today. Well,
once again, I'm sure people really appreciate your time, and if people have more questions, we'll book you in again.
Most definitely, Paul. I look forward to it.